Good morning. Welcome to Sunday Health Update with North Shore Gastroenterology. This morning we are very pleased to have with us Dr. Kimberly Harris. Welcome on this wonderful Sunday morning. We're going to talk about something that we hear a lot about from patients, something called SIBO. I wonder if Dr. Harris can tell us what is SIBO.
SIBO stands for small intestinal bacterial overgrowth, and that is the presence of excessive bacteria in the small intestines. Now, normally there's only a small amount of bacteria in the small intestines. In certain situations that alter the normal flow through the intestines, there can be an overgrowth of bacteria. These situations can occur after a surgery in the intestines and can also occur with some medical conditions that alter the contractions through the intestines, including diabetes and scleroderma.
Are there any symptoms that the patient typically complain of who have this condition?
The main symptoms of SIBO include abdominal pain, bloating, and diarrhea. The symptoms can really vary from patient to patient. Some patients will have only mild symptoms, whereas other patients will have severe diarrhea with weight loss. And in those severe cases, they may also develop vitamin deficiencies.
So, Dr. Harris, if the patient is suspected of having small intestinal bacterial overgrowth, what testing can they have?
Here at North Shore Gastroenterology, we offer a breath test that can be used to diagnose SIBO. Essentially, the patient comes to our office and they have a baseline analysis by breathing into a machine. They then drink a sugary beverage, and at 20-minute intervals for a total of 3 hours, we ask them to reevaluate the breath. After 3 hours, a physician can interpret the result to tell a patient if they have SIBO.
And what kind of treatment, if we establish that diagnosis, is available to patients?
The main treatment includes antibiotics, which help reduce the bacterial load. For each patient, it's also important to help determine the cause of small intestinal bacterial overgrowth so that we can help guide further treatment.
Well, thank you very much for this update, and thank you again for joining us this morning.